Good evening. My name is Ryan Sullivan. I'm going to be going over the Jackson Township Fire and EMS program with you. This is for EMS System Design class, and thank you for having me. What we're going to talk about is a short introduction. This EMS program is designed to improve community health through an integrated, proactive approach to EMS services by focusing on faster response times, reducing non-emergency calls, and increasing community involvement in preventative health measures. We aim to create a healthier, more resilient community. We are committed to advancing public health by incorporating mobile health services and preventative care initiatives. These efforts will help to alleviate the burden on emergency departments and promote a culture of health and well-being. Our program aligns with the current research emphasizing the importance of proactive EMS and improving community health outcomes. Our program and goals and objectives are achieving faster response times to emergencies. Obviously, the faster we get there, the faster we can help. Second is increased community involvement in health and wellness initiatives. And then reduce the number of non-emergency visits to the emergency room. Obviously, a lot of us are working on that currently. And then the key objectives are achieve an average response time of 8 minutes or less for high priority calls. And then more importantly, reducing non-emergency 911 calls by 15% within the first year of the program implementation. These objectives are in line with the current recommendations for EMS performance in regard to NEMSQA. Also, we would do a community needs assessment, or we would go by the county's community needs assessment, which we just did one in 2022. We would use that comprehensive community needs to look at our demographic data and then look at health surveys and frequent incidents. The key findings that we may see, and you can see by the chart, some of these are available in our county. A high prevalence of chronic illness within the community that may even involve mental health and behavioral health and illness. Limited access to preventive care measures or services, and then a high rate of non-emergency 911 calls. The implications for this is these findings highlight the need for targeted healthcare outreach and preventative services to address the underlying health needs of the community. Obviously, most people call 911 or think the fire department's going to help them. So we're already in this place, so we can assist them with that. We will put together a strategic plan, critical resources or advanced EMS vehicles that are equipped with the latest medical technology. We already have highly trained paramedics, but we also would make them a little bit more specialized with specialized skill and certifications, especially if they're certified in community paramedicine. And then we would work towards getting cutting edge technology for data tracking and analytics. Currently, through our EHR provider, ESO, we can start tracking these things immediately. And then we would collaborate with hospitals and community organizations and public health agencies to maximize the resources and expand the program's outreach. Obviously, that cutting edge technology with data tracking and analytics would come in value with this, as we would have to prove our worth of what the program we've been doing so far. Next, the overview for our program is our model is that we propose implementing a mobile health integration or community paramedicine model to address identified community needs. How we would implement this is we would start with a pilot study or pilot test. We would conduct a small-scale pilot program to test the model and identify any initial challenges or areas for improvement. And then we would work towards a full launch. Following a successful pilot, we will launch a program on a community-wide scale. And then we would scale it from there over the next 2 years. We would gradually expanding the program and making adjustments based on ongoing feedback and evaluation. And obviously, this could increase, significantly more if we had more connections with hospitals and local clinics. The financial projections are, we have estimates based on this. We would develop a detailed cost estimate for staff and training technology for the first 3 years of the program. Obviously, we want to, shoot ahead, so we're prepared for funding. We would look for funding resources or sources. We would pursue a variety of sources: federal grants, SAMHSA, local business donations, healthcare provider partnerships, and community fundraising. Obviously, there's more and more federal and state funding that's coming out, so we would most likely apply for them also. We'd have to do staff training and development. So the requirements would, we would receive comprehensive training in community paramedicine, public health, and pandemic preparedness. We would do ongoing education. We're obviously committed to providing continuous training and professional development opportunities for all our EMS personnel. So ongoing education and learning more as we get into community paramedicine would be paramount. And then obviously our goal is to ensure that all EMS staff have the knowledge and skills to effectively respond to the evolving needs of the community. So as we potentially add programs to our system, we would have to continue to train our staff. So how do we evaluate our program? Obviously, we would conduct quarterly reviews and an annual assessment of the program and looking at getting our stakeholders together to look at it. We would get community feedback through surveys. We would have stakeholder meetings, and then we would look at performance metrics based off of NEMSQA or other types of community paramedicine programs. Overall, our goal is to evaluate efforts that will help us measure the program's success and identify areas of improvement. The qualitative evaluation, we can do qualitative or quantitative, but I'll explain both of them. Qualitative, we will collect qualitative data through patient satisfaction surveys, participant feedback, and EMS staff perspectives. The goal through this data will help us refine service delivery and address any challenges that arise. But also there's quantitative impact assessment. So what outcomes are we looking? We're looking for reduced non-emergent calls, faster response times, improved patient care continuity. And then we look at data, track incident reports, response times, resource usage, and then measure programs' impact on community health. Obviously, between qualitative and quantitative has a little bit more bang for buck when it comes to data and showing, obviously, if we want to build our stakeholder or our partnerships in the community. But obviously, using a little bit of both of these would be helpful, maybe leaning a little bit more towards quantitative over qualitative. But we want to utilize both type of assessments moving forward. So the impact, obviously, and the outcomes we would be looking for are faster emergency response times, reducing non-emergency 911 calls, overall improved community health outcomes, which we would be looking for, Stark County Health Department through their community needs assessment or hospitals and looking at patient outcomes when it comes to community health. We would align with community needs and public health priorities, and then proactively approach to community health by getting out there, showing our resources, what we have available to us, and what we can help other resources in the county get out to the community faster. So future directions and community impact, future areas that we could potentially dive into is mental health services, telemedicine partnerships with potentially hospitals like hospital home programs and or local physician offices. And then also we could look at community-based EMS, just looking at the community and assisting the Stark County Health Department with initiatives within the community or vaccination programs, etc. And then obviously above all this, we want to increase community engagement. So proactive, not reactive healthcare. We want to get out there and make sure people are on top of it. Like right now, people should be getting their flu vaccine. So we could be, giving flu vaccines in the community. We would try and strengthen our partnerships that we've already increased in the community. And then obviously we want to obviously see improved health outcomes. These are my references. Thank you very much for your time. Have a wonderful day.